Good evening, everyone. Dr. Ryman here. This is going to be live from the new Apollo East office. So, had a big personal move over the weekend, crushed it in under 48 hours, out of all the boxes, all packed up, and now I have a very cool circadian cave. So, lots of skylights, lots of natural light, and of course, went through it and changed out all the nasty LEDs into some nicer, cool red lights and some UV lights. So sometime I'll do a kind of a tutorial of how to biohack your home and make it more circadian friendly. But tonight I wanted to share kind of the third part in the non-invasive testing series. So the prior 2 weeks we talked about the CT coronary calcium score, which is the test that looks for calcium in the walls of your artery. That's a sign that the arteries have developed pretty late stage plaque in the arteries. And it's a great test. Over the age of 40, if your score is 0, you're still at risk. Your score is greater than 1, there's plaque building up, and we've got to figure out why that plaque is present. And then last week, we talked about the carotid intimal medial thickness test. Essentially, how old are your arteries? That was Dr. Thomas Sintam from the 1600s saying, a man is as old as his arteries. So the carotid intimal medial thickness test looks at the lining of the arteries. The thicker it is, the more inflammation is present, the more likely plaque will continue to build in the arteries. So if you want to know, can you stabilize plaque? The answer is yes. Do you want to know, can you reverse plaque? The answer is yes. What is the best test to look at that? That would be that carotid scan, because if the intima is shrinking down and the soft plaque shrinking down there, you're shrinking down plaque in the coronary arteries and likely in the other 60,000 miles of blood vessels that you actually have. So tonight we're going to talk a little bit more about endothelial function. So I've given previous talks on this, but this is going to be for the new people that are following me, and also just a refresher for those that want to hear it. So endothelial function, that's the name of the game if you want to have healthy arteries. So the endothelium is the inner lining of your arteries. It's 1 cell thick, and if you took out your endothelium from your 60,000 miles of blood vessels, you'd have the surface area of 6 tennis courts. It's the largest secretory organ in your body. And from a vascular standpoint, the main thing it releases is something called nitric oxide. In 1998, the Nobel Prize was awarded for the discovery of nitric oxide and how it helped the cardiovascular system. So, there's other forms of nitric oxide. We're not getting into those tonight. Sometimes nitric oxide is not necessarily a good thing, but for the vessels, for the most part, it's a good thing. So the endothelium, on top of it, there's something called the glycocalyx. The glycocalyx is like a gel coat. Or you think of like little ciliary hairs that float on top of the endothelium. And it's sensing what's floating through your bloodstream. If there's high inflammation in your bloodstream, if there's infections in your bloodstream, if there's high insulin and glucose because you're insulin resistant or diabetic, that glycocalyx will get damaged. It's like getting a haircut. Then the endothelium is getting bombarded with whatever's floating through your bloodstream. It stops releasing nitric oxide effectively. Nitric oxide, when it's present, will cause the arteries to relax. It causes the smooth muscle in the artery to relax. That improves flow. That improves blood pressure. But nitric oxide also acts like non-stick surface. So when things are floating through the bloodstream, as long as it doesn't stick like Velcro to the artery, it'll just keep on going by. So, there's no such thing as good cholesterol. There's no such thing as bad cholesterol. But you don't want cholesterol to be deposited in the arteries. The way it deposits in the arteries is that there's endothelial dysfunction. The arteries can't release nitric oxide. There's generally inflammation present. And then there's the lipoproteins, which are carrying the triglycerides, the cholesterol, the vitamins, the phospholipids. They're going through the system, and then it just basically sticks like Velcro to the artery and then gets downloaded into the walls of the artery, and its payload goes in the artery instead of to your muscle cells or your other organs. So the first thing is keep a healthy endothelial barrier, and that process is not likely to happen then. So how do you test your endothelial function? So I gave a podcast earlier today. I said kind of the take-home way to do it would be, do you have normal blood pressure? I've given previous talks on what is a normal blood pressure, but ideally it should be less than 120/80 without medications. So if your blood pressure is elevated, that's often a sign that you don't have healthy endothelial function. Because if you don't have nitric oxide to dilate the blood vessels and the arteries are constricted, the blood pressure increases. So if you have normal blood pressure, more likely to have healthy endothelial function. If you have high blood pressure, got to figure out if there's some other secondary causes for it, but generally just assume you have low nitric oxide levels. The second thing you do is there's salivary test strips you can get online. You put saliva on your finger, you dip the little test strip on it, You look at it, what color changes. So it's kind of like litmus paper. If it's bright red, you're making good nitric oxide levels from your saliva. If the level is white, you're not making good nitric oxide levels from the salivary pathway. And that's one of two pathways to make nitric oxide. One's through your saliva, one of them's through the L-arginine pathway. So you can test that stuff at home. Now, would you need a doctor or a hospital system that would have it, which would be rare because most of the time they're in the business of treating heart attacks, not necessarily preventing them. But two tests that I offer in the office. One is called a MaxPulse. It does a pulse wave velocity test. So if you've gone to the doctor and had a finger probe put on to measure your oxygen saturation levels, similar technology. But it's also looking at the volume of blood that's going in your small blood vessels. So as the blood leaves your heart, it goes down your arm into your fingers, and if the arteries are healthy, it should expand like an accordion and quickly contract. That's the elasticity. If you have lead pipe arteries, the blood will go down there and bounce back real quick. That's analogous to, you splash some water in a pool and it hits a wall and it reflects back. Well, if it bounces back to you really quick, you have basically a very stiff artery. Sometimes the artery is stiff because there's a lot of plaque in it, or there's issues with constriction for other reasons, but often it can be nitric oxide deficiency. If you have low nitric oxide, the artery can't quickly expand and contract when that large volume of blood comes at it. So that is one test you can get. The other test that's offered is called an EndoPAT. That measures brachial reactivity. So the brachial artery is the artery that's in your arm. It's a good surrogate for what's going on in your heart, but you basically do a stress test to the artery. How much nitric oxide can it release when it's under stress? The stressor is induced by putting a blood pressure cuff on the arm and pumping up the blood pressure higher than your blood pressure, so that temporarily cuts the flow off to your hand. Not dangerous, but you may get that pins and needles sensation. And then after 5 minutes, you open up the blood pressure cuff, the blood rushes back down into the hand, and you get what's known as reactive hyperemia. So, meaning the blood flow rushes down there, there's shear stress on the small blood vessels. Those small blood vessels, when they see that large volume of blood, if they're healthy, will release nitric oxide, so they'll dilate to accept that volume of blood. The test will give you a value called the Reactive Hyperemia Index, the RHI. It will give you essentially the amount of dilation of the artery when it's under stress. A normal RHI would be greater than 1.68. Normal is 2.1, meaning the artery can double in size, 210% over the baseline. But more optimal would be a 3 to 4. Rarely see it, but in some fitter people, I've seen levels in the 3 or 4. Sometimes they're supplementing, sometimes they're not. But if you have healthy endothelial function and you're young, you're not likely to develop plaque in 7 to 8 years, because usually endothelial dysfunction happens many years before the plaque develops. If you already have plaque in your arteries, meaning you've already had an abnormal carotid intimal medial thickness test, you've already had an abnormal calcium score test, all is not lost, but you have to regain endothelial function. So if you do the test and your RHI is 2.1 or greater, then whatever was putting the plaque in your arteries before is likely been stopped, and you're possibly in the place where it's kind of frozen in place. And over time, you may actually get it to regress. So you need to have healthy endothelial function before the arteries are going to heal themselves. So that's what I'm going to share tonight, is that there's 2 tests that you can do at home. Make sure you have normal blood pressure, ideally under 120/80 without medications. And then you can get salivary nitric oxide test strips online. Amazon sells them. There's other companies that sell them. If you're one of my patients, I talk about them in my office. But if you want to go deeper down the rabbit hole of how healthy the endothelium is, the 2 tests I really look for is something called pulse wave velocity test. There's a couple different companies that make it, but one good one is MaxPulse. And then the other thing is to look at something, the brachial reactivity, that can measure something called the EndoPAT, or the endothelial function test. So if you're interested in doing those tests in the St. Louis area, just drop me a message or call my office. But open up to any questions you guys have tonight. And then next week, be doing Ask Me Anything, December 2021 version. We'll talk about any type of cardiovascular topics you want to talk about. Again, I'm doing some more podcasts this week, mostly talking to the bodybuilding communities. They've had a few people unfortunately pass away from early cardiovascular disease in the past couple of weeks, and so talking about these exact same types of tests. But if you want to know more about circadian biology, or you can see I'm obviously lit up red with some, I have one of my giant photobiomodulation panels on me right now. If you want me to do one of those talks, just let me know, and we'll get back on the schedule doing some of the photobiomodulation talks. But next week's going to be an Ask Me Anything, and then starting the following weeks, going to start talking more about how to optimize your sleep, how to optimize your stress, how to optimize your nutrition, how to optimize your exercise routine, the 4 pillars of health that I frequently talk about. Now I'll kind of close out the series, how do you assess your arteries, how healthy are they, and then what are the 4 big things you need to do to keep healthy arteries. And then we have some big news in January of 2022. For my patients who are located in St. Louis, we're going to be offering a membership model. If you're already one of my patients, there's no obligation to join the membership model, but it's an option. And the membership model is going to be all based on becoming heart attack proof. So the tests I've just been talking about the past couple of weeks, the calcium score test, the carotid medial test, the MaxPulse, the EndoPAT, that's all going to be included. We're going to be scanning your arteries on schedule when we need to schedule them to see have we stopped the plaque from growing and are we getting it to regress. So it's going to be a comprehensive arterial health program. So if you're interested in that, stay tuned to my Instagram post. And then, if you're not already on my email list, you can sign up with my email list. Just go to drkleiman.com/news. Join the email list to know when more information about the membership models come out. I'll likely do a webinar via Zoom at some point, and may even do a special IG Live for questions about the membership model. But thank you guys for joining tonight, and I'll stick around to answer any questions you got. All right, good question. So, what can I do if my husband feels like he can't fall asleep without the TV on? It compromises my sleep hygiene, and I'm concerned for his own. He wakes up a lot in the middle of the night. So, circadian biology is the apex. You have to, focus on your light environment if you want to have optimal health. And so, first, lead by example. I always do. That's why you guys always see me lit up red here, because it's pitch black in St. Louis at this time of the year. You always see me wearing the blue light glasses. I lead by example. So do what you need to do to protect your own circadian biology. Then, the data on TVs and sleeping with them, a couple things. Obviously, the light environment's horrendous for you. The light from your TV basically tells your brain it's noontime. Cortisol rises, stress hormones rise, and you're supposed to be alert. You're supposed to go out for the hunt. Your melatonin levels are suppressed. Melatonin helps you initiate sleep, but it helps you stay in deep sleep. And you really need healthy levels of melatonin to repair your mitochondria. It's all about your mitochondria and how much energy they can make or how much energy they can store. So, looking at TV right before bed without protecting your eyes is probably going to impact your sleep, especially if you track your sleep. If you use an Oura Ring or Whoop band intermittently to look at it, you'll see your sleep scores are really off when you do that. Second thing you don't want to do with the TV is you don't want to be subconsciously listening to whatever noise is coming from the TV. Especially if it's negative. If you have the news on and you're hearing all about, crime and war and badness in the world, that's getting imprinted on your brain, and that's going to affect your mood and energies the next day. So, if we're going to talk about, your bedroom should be a cave. It should be dark, cold, and quiet. And so, lead by example. But, I've known some other physicians who are much more brash than I. If the lights stay on, they take evasive action. Separate bedrooms. You have to do what's best for you. All right. So somebody's asked me a question about what nitric oxide supplements do I recommend. It's always individualized to the person's context, but first you got to figure out why the nitric oxide levels are low. Is it a salivary pathway? There's a couple supplements that help with that. Is it something that's wrong with the liver? Sometimes you got to fix some things there. So I don't give out general supplement advice, via Instagram. I can't practice medicine one-on-one via Instagram. So those are best, one-to-one in an office visit if you want to know exactly what, you should take for your own health. But there's many things that can improve it. But generally, first start with the basics. Circadian biology, optimize it. UVA sunlight. Hit your skin, releases nitric oxide. Exercise. Muscles getting stimulated, releases nitric oxide. Red light therapy, releases nitric oxide. Eating your beets and greens, that can help. Make sure you don't use anything that destroys the bacteria in your saliva, such as things with fluoride in it, such as antibacterial mouthwash. If you're on an acid-blocking medicine, like Prilosec or Protonix, some of that, talk to your doctor. How long do you need to stay on those things? Because if you don't have stomach acid, you don't digest proteins appropriately. If you don't digest proteins appropriately, you don't have the right enzymes. If you don't have enzymes, you can't make these chemical reactions happen. So if you're something is broken in your stomach acid and you're popping a bunch of supplements, you're not going to get the benefit out of it. So you need to know the context before you make an individual recommendation. Got a few people joining in, so we're just at this point just taking some questions. We chatted about endothelial function. The endothelium is extremely important for arterial health. Your endothelium is the key to longevity. If you have healthy endothelial function, you have healthy arteries. You have healthy arteries to provide the nutrients, oxygen to your cells to do what they need to do. So endothelial function mostly comes down to how much nitric oxide you can produce and keep. So if you're interested in doing more testing, the test to look for that is something called the MaxPulse or the EndoPAT. And this will be on replay in just a few minutes. Somebody's asking, should they use a 5-wave at night? 5-wave is just one of the types of photobiomodulation panels. Depends what you mean by use at night. So for the most part, if you use just the outer lights on for task lighting to get around the house, it's fine. But no, it is not recommended to do actual photobiomodulation sessions at nighttime. So best time to use it, sun up to sundown. Make it recreate what Mother Nature intended. So lots of people using these extremely bright lights at night can still affect their sleep quality. So I have a partial question here. I don't know exactly what was getting at. What would BWV be the, not sure. All right, so I assume this is lipoprotein little a and not LPPLA2. So LPLA, I've done previous talks on it. There are not great ways to lower it at this time. LPLA, for those that haven't seen the previous video, it's a genetically inherited lipoprotein. It's very similar to LDL, but it's more atherogenic and more thrombogenic, meaning it's more likely to cause plaque in the arteries, it's more likely to cause blood clots in the arteries. You either get it from your mom or dad, and it's something that's made in the liver. It's like a little corkscrew, and the little corkscrew basically binds onto the LDL particle and just makes it easier for it to dig into the arteries. It's definitely very good at causing endothelial dysfunction in certain people. Now, there are some people that will be on estrogen replacement for appropriate reasons. Estrogen can lower LPLA, but it is not recommended to start estrogen replacement therapy just to lower LPLA. Now, I've previously in the past used niacin for this indication. Niacin is one of the B vitamins, but honestly, niacin really rarely lowers it significantly. A significant lower in LPA is on the order of greater than 80%. LPLA is usually extremely difficult to lower. It basically has a genetic set point. So, your levels are going to be pretty much your levels at adulthood. So, very few things will adjust it. Exercise has no role on it. Nutrition has no role on it. Niacin has a little bit of an effect, and estrogen has the effect. Now, there's all sorts of other things. The Pauling protocol might or might not work. The PCSK9 inhibitors, Praluent and Repatha, been noted to lower LPA a little bit, but again, nowhere more than really, from my memory, more than 10 or 20%. And no insurance company is going to cover the injectable PCSK9 inhibitors just for LPLA. Now, if you have other issues and you're on it and you get the added benefit of LPA going down, great. But honestly, it's going to be 2-3 years before the phase 3 drug trials come out. There's drugs called antisense oligonucleotides that lower LPA 95%. It basically makes the body stop making the little lipoprotein A corkscrew, the Kringles. So if you don't make those things, you can't stick them onto the LDL particles. One thing I failed to mention was that the best thing that actually lowers LPA at this time, not commonly done in the US, is apheresis. So kind of like a dialysis type of system where your blood's taken out, spun down, they pull out the LPA particles and they put your blood back in. Pretty common in Germany and indicated there, but I've not personally ever sent anybody for the testing, and I'm currently in St. Louis. I believe maybe the one medical institution in town possibly does it. The one I trained at did not, so it's not something I would truly recommend for most people unless they've had multiple events, especially early events, heart attack, stroke, got bypassed at like age 45 or something like that. Then maybe I'd recommend apheresis for that person. But generally, the goals are get the ApoB particles down, into the 50s, 60s, get the LDL particles down to under 1,000, and then cool down all the inflammation. Because if inflammation's under control, especially LP-PLA2, which also is known as the plaque test, and also for a couple of companies you can do an oxidized LDL, but a better one would be the oxidized phospholipid on ApoB. If that is normal, then LP-OA is probably not necessarily causing any damage at the time. But if you have high LP-OA, high oxidized phospholipid on ApoB, high LP-PLA2, expect to have significantly thickened intima and soft plaque likely building up in that person. And then somebody asked a question about do statins raise LP-OA and does that become a problem beyond the statin? Great question. So yes, it potentially will increase LP-OA, but it's an order of magnitude less important than getting the LDL particle count down or the ApoB count down. So it's not one of those things where if you saw the LPA going up, they would think that there's a major problem. You're mostly going to want to look at kind of all the downstream effects. How healthy is the endothelium with that? How much, if you have plaque, is the plaque stable or regressing? The statins have a lot of pleiotropic effects. It does more than just affect the lipids. It's lowering inflammation and it stabilizes plaque. It turns that soft necrotic plaque more likely to cause rupture and a heart attack and turns it into a more fibrous and calcified plaque. So, let's see. So Jeremy joined. Thank you for joining, Jeremy. Tonight we're just chatting about endothelial function. So how healthy are your arteries releasing nitric oxide? Nitric oxide's, name of the game if you want to have healthy arteries. All day long is my answer for this. So how much time exposure to red light therapy do I have per day? Depends if the question is, how much photobiomodulation do I do? I honestly don't do it every day. I should back it up. I do a little bit every day. So usually I do at least 20 minutes a day just to kind of the chest area, just for general wellness purposes. If I bang myself up working out or, cut myself, I got a lot of hand, abrasions as we get moved into boxes and stuff, so I just treat it with that kind of spot welding. But most of the time, photobiomodulation, if you have a musculoskeletal injury, it's best done once a day until the injury is healed up. But otherwise, how much red light exposure I get to, like I said, it's pretty much all day long. So an optimal circadian day would be, I'm up, before sunrise right now. So I put on the blue blackened glasses. I don't see any artificial light in the morning time. I was talking earlier, if you weren't on there, I just recently moved and I biohacked the house and redid the whole lighting system. So, it's all, looks like a submarine, from the outside. So red lights in the morning time, just more for task lighting. During my coffee in the morning, sit down for my red light, do a session of red light therapy while reading. And then sunrise is about 6:30 here right now. Go out for usually about an hour walk and get a lot of red light from the sun. That red light is regenerative from sun up to sundown. So you don't have to have one of these fancy panels. You can always use Mother Nature. But then when I'm inside, typically, I will have one of the red light panels on more as task lighting. It also somewhat balances out some of the artificial light coming from your devices. Your devices put out 3 to 4 times more blue light than it does red light. So having red light on balances out a little bit. And then the other kind of for the win is, even if you're inside and you don't turn on the junk LEDs or the compact fluorescent lights, just natural light coming through your windows is filtered. A lot of the red and infrared light gets filtered out because the windows are energy efficient. They're blocking some of that heat transfer. So more of the high intensity blue light gets through the glass. So if you have a spectroscope, you'll be able to see that. Most people don't have one of those devices, but you can somewhat add back some of that red light that gets subtracted from the glass by having it on inside whenever you have the artificial lights on, you're in front of a screen, or you're just in front of a window. All right. And for those that are joining at the end, this is obviously going to be recorded. This will be on IG Live replay pretty soon. This also will end up on my YouTube channel at some point. If you want more information about it, you can follow me on my newsletter. I send it out generally on Sundays. Just drtwyman.com/news, and you can be first to know any updates. Did talk earlier, going to have a Ask Me Anything next Monday, 6 o'clock Central Time. So if you have a cardiovascular question, or biohacking question, or circadian biology question, or photobiomodulation question, just let me know, and we'll answer it at that time. And then be on the lookout. Going to be launching a new membership, program in January 2022. All right, guys. So I think the questions are kind of lining up. So I appreciate your time. Thank you so much for joining me tonight. If you need anything in the interim, shoot me a message, and we'll see you guys next week. One last thing, I am doing a VIP retreat down in Cancun this Thursday through Sunday, so I'll try not to give you too much FOMO, but going to be teaching some people about optimizing their circadian rhythms and showing them how to optimize their light-water magnetism, or Sun, Sand, Sea is what I'm going to be calling this. So you get those 3 S's, you get survival. So enjoy your week, guys, and I'll be in touch soon.